Today, we're going to dive deep into hypertension, or high blood pressure. We're going to explore exactly what happens inside your body when that pressure stays elevated, how it systematically damages your vital organs, and why waiting around for symptoms to show up is, well, it's a really dangerous gamble.
To really understand the gravity of this condition, I want you to picture a guy named Michael. Michael is 52 years old, he's a father, he goes to work every day, plays with his kids on the weekends, and he almost never gets sick. For all intents and purposes, Michael felt perfectly healthy. But then, one afternoon, just driving home from work, something changed. Out of nowhere, his vision became blurry. This strange, incredibly heavy feeling just washed over his left arm, and within minutes, Michael found himself being rushed to the emergency room. The diagnosis absolutely shocked him and his entire family. Michael had suffered a stroke, and the attending doctor had to sit down and explain to him that his blood pressure had been dangerously high for years. It had basically been a ticking time bomb just waiting to go off inside his circulatory system.
Now, Michael just couldn't believe it. He had no symptoms, no warning signs, no pain, literally nothing. And look, this is exactly how the silent killer operates. Every single year, millions of people walk around living their lives with dangerously high blood pressure, and they don't have the slightest clue that it's even there. The condition just quietly damages the arteries, the heart, the kidneys, and the brain year after year until a catastrophic event finally happens. People so often discover that they actually have hypertension only after they've already suffered a heart attack, a stroke, or kidney failure. It's a terrifying reality for sure, but understanding the actual mechanics behind how this works, that is our very first step towards stopping it.
So before we go any further, we really need to establish what blood pressure actually is. I want you to think of your circulatory system as this vast, incredibly complex network of highways stretching throughout your entire body. And your heart, well, that acts as the central pump, just pushing blood through thousands of miles of these vessels. Every second of every single day, this blood is delivering life-saving oxygen and nutrients to your organs and your tissues. Now imagine turning on a garden hose in your backyard. If the water flows smoothly, everything works perfectly, right? But if the pressure becomes too high, that hose begins to experience some severe strain. Over time, that excessive, constant force weakens the material, causing damage and massively increasing the risk of it bursting. Ultimately, blood pressure is simply the force of your blood pushing against the walls of your arteries as your heart pumps.
So, let's demystify those numbers you hear every time you get a checkup. You know the ones. When we measure your blood pressure, we are actually looking at two distinct phases of your heart's pumping cycle. That top number, that's your systolic pressure. This measures the absolute maximum pressure inside your arteries at the exact moment your heart contracts and forcefully pumps blood outward. The bottom number is your diastolic pressure. This is the resting pressure that stays in your arteries when your heart briefly relaxes between beats to refill with blood. Understanding these two numbers is absolutely crucial because they tell us exactly how much force your arterial walls are constantly enduring, both at their peak exertion and when they're supposed to be at rest.
For most healthy adults, a blood pressure reading right around 120/80 is considered normal and safe. At this level, your body is getting all the blood flow it needs without putting any undue stress on those vessel walls. But here's the hard medical reality. As those numbers climb higher, say past 130, 140, or even up to 160, the strain on your body's systems increases exponentially. Your blood vessels, your heart, your kidneys, and your brain are suddenly being forced to operate under immense unnatural tension. And because the human body is remarkably resilient, it's actually going to try to adapt to this pressure, which unfortunately masks the problem entirely.
Please let this sink in. The absence of symptoms does not mean the absence of damage. I cannot stress this enough. I hear patients tell me all the time, "But doc, I feel totally fine." The truth is, you can live a completely normal life while elevated pressure silently ravages your arteries. That microscopic damage, it starts years, sometimes decades, before you ever feel that first pang in your chest or that sudden spell of dizziness. High blood pressure doesn't suddenly become dangerous when the symptoms finally appear. It becomes dangerous the exact moment it begins damaging your body on the inside. And this creates a true head-to-toe clinical crisis. When traffic is forced through your arterial highways at these dangerously high speeds, it wears down the incredibly delicate inner linings of the vessels. Let's look at the brain. Up there, weakened vessels can actually rupture, which leads to strokes or even long-term cognitive decline. In the heart, this constant strain causes the muscle to stiffen and eventually fail. Down in the kidneys, that high pressure literally destroys the delicate little filtering vessels, leading to kidney failure. It can even cause the tiny, microscopic vessels in the back of your eyes to leak, leading to blurred vision or irreversible vision loss. As you can see, it is a total systemic assault on the body. So exactly how does that cardiovascular damage progress over time?
Well, imagine you're forced to carry a really heavy backpack. And I don't mean just for a quick afternoon hike, I mean every hour of every day for years on end. Eventually, your muscles are going to become completely exhausted. When your heart has to pump against constant high pressure, it actually tries to compensate. It builds more muscle to handle the load, which leads to heart enlargement. Now, in a lot of situations, bigger muscles might sound like a good thing, but in the heart, a thicker muscle actually becomes rigid and stiff. It loses that essential elasticity and becomes highly inefficient at filling with and pumping out your blood, which ultimately brings us to the tragic final stage, heart failure. The pump just simply burns out.
But the problem isn't just the pump, right? It's the pipes too. A healthy artery is beautifully flexible, very much like a brand new stretchy rubber hose. But when put under constant high pressure, your arteries actually try to defend themselves by becoming thicker and more rigid. Think back to that garden hose analogy. Imagine an old hose that's been left out in the baking summer sun for months. It gets stiff, brittle, and really prone to cracking. This stiffness creates a vicious compounding cycle. You see, the stiffer the arteries become, the harder the heart has to work to push blood through them, which in turn drives the overall blood pressure even higher. At this point, you might be wondering, okay, why does this happen in the first place? Well, in medicine, we are always looking for root causes. And for the vast majority of patients, hypertension isn't caused by one single traumatic event or just eating one bad meal. Instead, I want you to view it like an overflowing bucket. Your blood pressure rises slowly over years as multiple physiological and lifestyle factors just quietly accumulate. One single drop, one factor, isn't enough to cause a problem on its own. But as drop after drop is added to your bucket, eventually the system just can't hold it anymore and it overflows. Let's explore what's actually filling up that bucket. The most notorious culprit we deal with is the severe imbalance between sodium and potassium in the modern diet. Excess sodium, which is very often hidden in massive, unbelievable amounts within processed foods and restaurant meals, forces your body to retain water. This extra fluid directly increases the physical volume of blood circulating through your system, creating way greater pressure against your artery walls. But you know, sodium is only half the physiological story here. The other half is low potassium. Potassium is sodium's natural counterbalance. It physically helps your kidneys flush that excess sodium out, and it actually relaxes the blood vessel walls. When you consume too much sodium and too little potassium, your body completely loses its ability to regulate its own pressure. But remember, the bucket doesn't just fill up with sodium. Excess body weight, chronic stress that just floods your system with cortisol day and night, and poor sleep or sleep apnea all majorly contribute. Then you add in physical inactivity, insulin resistance, and the incredibly toxic vascular effects of things like alcohol and smoking. These factors do not exist in isolation. They overlap, they feed off each other, creating the absolute perfect biological storm for hypertension to thrive. Now take a breath. I know everything we've covered so far sounds pretty alarming, but as a doctor, this is the exact moment in the consultation where I get to look my patient in the eye and give them some real hope. Because the very factors that drive hypertension are often the exact same factors that can be improved. You are not powerless against this silent killer. Your blood vessels are dynamic, your body inherently wants to heal itself. Understanding these interconnected causes means you now hold the blueprint to dismantle them. Many of these harmful processes can be slowed down, stopped, and in some cases completely reversed simply by changing the inputs we are giving our bodies. So this brings us to the most vital question of all. If we know exactly how the bucket overflows, how do we start emptying it? What are the specific, scientifically proven interventions that can actually relax those stiff arteries, rebalance those vital minerals, and bring your cardiovascular system back from the brink without just immediately resorting to a handful of daily medications? Well, there are precisely 15 highly effective, natural strategies to lower your blood pressure right from the inside out.
All right, let's get into it. Section 1. Remedies 15 to 11. The Cardiovascular Foundation. Managing this silent killer doesn't start with some magic pill, right? It starts with fundamental daily habits. Looking at our first 5 remedies, they're beautifully simple yet profoundly effective. Coming in at number 15 is hydration. When you're chronically dehydrated, your blood volume actually drops, and your body literally has to constrict your blood vessels just to maintain circulation. So drinking enough water physically assists your arteries. Moving on, at number 14, we've got magnesium-rich foods. Think pumpkin seeds and spinach. Magnesium literally helps the muscles surrounding your blood vessels relax, keeping your arteries nice and flexible. Now, number 13 might just be your favorite, dark chocolate. And we're talking 70% cocoa or higher here. It is absolutely packed with flavonols that signal your arteries to widen. Number 12 is deep breathing. This actively deactivates your fight or flight, sympathetic nervous system, naturally bringing down that heart rate. And number 11, hibiscus tea. This is a really powerful beverage, clinically studied for its antioxidants that step in to combat vessel-damaging oxidative stress.
Moving right along to Section 2, Remedies 10 to 6, Nutrients and Recovery.
As we enter this next tier of our countdown, the overarching theme we're looking at is recovery and inflammation reduction. At number 10, ground flaxseed. This delivers powerful plant compounds called lignans that actively protect your vessels. Number 9 is better sleep. During healthy sleep, your body undergoes what we call blood pressure dipping. This allows your cardiovascular system to finally rest and lowers dangerous levels of the stress hormone cortisol. And speaking of which, number 8 is reducing chronic stress. You've got to interrupt that prolonged elevation of adrenaline that keeps your blood pressure artificially spiked. Number 7 is garlic. Garlic contains allicin, which is a compound that ancient tradition and modern science agree completely enhances nitric oxide activity to naturally open up those blood vessels. And rounding out this tier at number 6, omega-3 fatty acids, the kind found in fatty fish. These actively reduce chronic inflammation and really improve the overall flexibility of your arteries. All right, here we go. Section 3, the top 5 blood pressure remedies, the heavy hitters.
Let's slow down our pacing just a bit here as we get into these heavy hitters, because these are the most heavily researched and clinically impactful strategies you can possibly implement to naturally control hypertension. This brings us to remedy number 5, beetroot and nitrate-rich vegetables, things like arugula and spinach. See, your body converts the dietary nitrates in these veggies into nitric oxide, which triggers a process called vasodilation. I want you to think of your circulatory system as a congested, high-pressure 2-lane highway. Vasodilation is basically the chemical process of expanding that narrow, jammed-up road into a free-flowing 6-lane highway. Traffic moves efficiently, congestion disappears, and the pressure on those artery walls completely plummets.
Coming in at number 4 is increasing your intake of potassium-rich foods. We're talking bananas, avocados, sweet potatoes. Now, to understand exactly why this works, imagine a constant, critical balancing act happening right inside your kidneys between sodium and potassium. When you have excess sodium, your body holds on to fluid, which raises the volume of blood pumping through your arteries, and obviously, that increases the pressure. Well, potassium is the antidote. It acts as the ultimate teammate that helps your kidneys efficiently filter out and flush away that excess sodium, restoring a healthy fluid balance and really taking that heavy load right off your cardiovascular system.
Which leads us perfectly into remedy number 3, reducing your sodium intake. Now, as your clinical guide today, I've got to warn you, the salt shaker sitting on your dining table, that is not the true culprit here. Not even close. It's the hidden sodium in processed foods that is really driving your fluid retention. Packaged soups, deli meats, restaurant meals, and even supposedly healthy breads and salad dressings, they are absolutely loaded with hidden sodium designed to extend shelf life and enhance flavor. Let me tell you, lowering your intake of these hidden salts is honestly one of the most immediate, effective ways to drop your blood pressure.
At number 2 on our clinical countdown is regular physical activity. The physiology here is beautifully simple. A stronger heart can pump a lot more blood with a lot less effort. When you engage in aerobic exercise, say a brisk walk or cycling, and pair it with resistance training to build muscle, you are actively conditioning the heart muscle itself. As your heart becomes a much more efficient pump, the sheer force and resistance placed on your arterial walls naturally decreases. It literally tackles the root cause of hypertension from the inside out. And here we are. We have officially reached the number 1 remedy. If I were to write you a definitive doctor's prescription today for the ultimate natural evidence-based intervention to lower your blood pressure, it wouldn't be a single supplement, it wouldn't be a solitary habit, it would be this. The DASH diet. That stands for Dietary Approaches to Stop Hypertension. And let me be perfectly clear about this. This isn't some trendy fad. This is a scientifically proven eating pattern designed specifically by cardiovascular researchers. It heavily emphasizes nutrient-dense whole foods while severely limiting highly processed sodium-rich items. So why is it number 1? Because it targets multiple root causes simultaneously. By following DASH, you're organically combining the potassium, the magnesium, the fiber, and the antioxidants we just talked about into one seamless daily lifestyle. And this brings us to a really vital clinical concept, the multiplier effect. High blood pressure is multifactorial, meaning it's caused by a combination of things: stress, poor diet, lack of sleep, inactivity. Think of your hypertension as carrying around a heavy backpack completely full of bricks. Taking out one brick, like drinking hibiscus tea, yeah, that helps. But when you remove 10 or 15 bricks by stacking all these healthy habits together, eating potassium, walking daily, getting better sleep, the benefits compound. The difference becomes dramatic. In fact, it becomes life-saving.
All right, moving to section 4, doctor's orders, your 30-day reset plan.
It is time to shift from theory to actual clinical practice and start building some momentum safely. Listen, we aren't aiming for overnight perfection here. We want consistent, steady progress. In week 1, you simply establish a baseline. Measure your blood pressure daily at home, start looking out for that hidden sodium on food labels, and just drink more water. Simple. In week 2, let's get your body moving with a daily 10 to 30-minute walk and really protect your sleep. By week 3, we upgrade your nutrition. Start adding bananas, sweet potatoes, and leafy greens to the mix. And finally, in week 4, we pull it all together by transitioning fully to the DASH diet and finding just 10 minutes a day to decompress and breathe. Step by step, you rebuild your health.
Let's move to section 5. Critical mistakes you must avoid.
Now I need to adopt a slightly sterner bedside manner for just a moment here. As we implement this reset, there are some essential medical warnings I've absolutely got to deliver. First, the most dangerous mistake you can make is waiting for obvious symptoms. Remember, this is a silent killer. Secondly, and I cannot stress this enough, guys, do not stop your prescribed blood pressure medication suddenly without professional medical guidance. Doing so can cause a highly dangerous, sometimes lethal rebound in your blood pressure. Furthermore, you can't out-supplement a bad lifestyle, you definitely can't ignore chronic stress and sleep apnea, and you absolutely must measure your blood pressure at home. You simply cannot manage what you do not measure.
Let's think back to Michael from the very beginning of our consultation today. He received a second chance, a real opportunity to protect his independence and enjoy the years ahead with the people who matter most. Every single small choice you make today, that glass of water, the 20-minute walk, getting the side of spinach instead of fries, is a compounding investment in your long-term survival. High blood pressure may be silent, but as you now know, your response absolutely doesn't have to be. So, I'm going to leave you with this question. Which one of these 15 remedies are you going to start with today?